Hello, I'm Dr. Karin Huffer. I'm here at the invitation of Indy and Sylvia, and I'm so glad to be here, very honored. I'm proud of the work you're doing and pleased to be a part of any of it that I can be. I'm a teacher and a marriage and family therapist, and I've spent the last 30 years studying how people interact with our systems of care. And I've found that we have a public health crisis. Initially, I was motivated because I saw the damage to public health by the actions of systems that are legally in place to serve the public. I saw children sitting by the wayside, often sent home from school when it was clear that they had a solvable problem. Nothing was illegal, it was just wrong, and it was dangerous. Consistently, these people suffered from stress to the point of diagnosable conditions, from anxiety and depression to post-traumatic stress disorder. Indy gave me 5 points that I appreciate that I will address. The first one is, how did I discover the idea of legal abuse syndrome? We'll call it LAS. I coined the term because human beings suffered symptoms of traumatic stress, not from earthquakes, not from accidents, but triggered by their interactions with legally instituted, powerful institutions, our systems of care, like schools, courts of law, bureaucracies, and enforcement agencies. I was shocked that our systems of care, even hospitals, forced vaccinations, discharged patients too soon. All are a public health menace if abuse of power exists. Whenever there is power differential, the person can be forced. Judges can jail on a whim. Educational systems can set guidelines that are rigid and irrational, such as refusing to use the most current technology, take online courses, solve problems, staying with old traditions, and losing their ethical compass, degrading the quality of life for the vulnerable. Most importantly, LAS is preventable. Therefore, for me not to address it would have been unethical and frankly unbearable to me. I began to research, write, speak, and put papers out for peer review. After a 10-year longitudinal study, the health consequences of legal abuses was validated. Something had to be done, so I began to design treatment protocols to help persons to not succumb to the constellation of symptoms of trauma, even PTSD when under extreme stress. It became clear that the recipe or formula for developing PTSD is to feel in jeopardy and helpless at the same time. All children must be provided a free and public education. They used to be excluded for behaviors that were nothing more than symptoms. Symptoms now have to be accommodated. They are never to be used as a cause for them to be punished or rejected. What did I know about your home-sitting children? What did I understand about it and their state of mind and their stress levels for the children as well as the parents when intimidated by the local government? The one thing I know about all people is the worst punishment for a human being is to be shunned. These children live with a sense of undeserved shame. They may have a disability. Some may be immigrants who are new to a culture. All people need attention to sort out their stresses, symptoms, and needs. They must be accommodated and included, opening their eyes and their hearts to their positive futures. One of our protocols we use in the healing protocols that I developed and continue to work on is a 3-step process. It checks how the person is appraising themselves. What do they say about themselves? How are you feeling? Very often they'll respond, I feel so stupid. Then you stop them and you say, what is the reality of the situation? And finally, The last thing we do is we explore what wisdom have we gained from this experience. That's just one of the things that we do to help that child not feel shunned and ashamed and left out and responsible when they're not.